Welcome back to tonight's show. I'm joined by our very own Nursing 201 student. May, how are you doing today?
I'm doing so good.
That's great to hear. So, May is here because she recently went out and interviewed a real registered nurse. She's here to talk all about what her experience was like, what she learned. May, so happy you could join us.
Thank you for having me.
Let's start from the beginning. What was it like to get to ask all of the questions?
So honestly, this experience was not only exciting, but it was also enlightening. My RN was so kind, and getting to ask her a series of personal and professional questions just grew my respect for the nursing profession as a whole and gave me a bunch of insight into what real life applications of all the course outcomes are.
That sounds amazing, May. Were there any responses that maybe surprised you?
Despite the fact that Nursing 201 prepared me for this interview by exploring the idea that nursing as a profession tends to consistently be rated one of the most trusted professions, it consistently faces unprecedented levels of workplace violence and is also rated one of the most disrespected or least respected professions. Now, when I heard about this in class, I was so confused because how can this be true? Well, how can nurses be seen as so important, but also at the same time be so disrespected? Then we went ahead and listened to the Gritty Nurse podcast, and they talked about, again, some of their experiences with workplace violence here in Alberta. I had no idea how frequently these incidents were happening, and hearing firsthand accounts from my RN with workplace violence was shocking and disturbing. It's just unacceptable, but it did give me this newfound appreciation and understanding of how resilient nurses truly are, and of the emotional toll that being a nurse takes on an individual.
That's definitely a tough reality. During this interview, did you find yourself resorting back to any communication techniques that helped you?
Absolutely. Therapeutic communication skills were a big part of this interview process. I started the interview by establishing rapport, and I introduced myself, set the scope of the interview. I did my best to not cross any professional boundaries by refraining from asking any personal questions that were outside of the scope of the interview. I refrained from using non-therapeutic communication skills like judging or giving my opinion when it's not needed, or resorting to automatic responses. I made sure that I was using active listening to make sure that my nurse felt seen and that she felt heard and comfortable.
It sounds like you're pretty intentional with the way that you're communicating. That's a great approach.
Definitely, it's so important to be professional while creating a comfortable space to have a conversation.
Big question. Did any of the RN's responses align with what you've been learning in your course?
Oh, 100%. I mean, my RN's experiences and day-to-day role highlights all of these key concepts we've been learning in Nursing 201 so perfectly, whether that's documenting or interprofessional collaboration, critical thinking, or ethical decision-making. Her experience and expertise really gave me just further insights into these concepts. Example being a language line. My RN was talking about how in her workplace there's been many instances when she has had to use a language line. This is a great example for overcoming a communication barrier. My nurse's responses really enlightened me and deepened my understanding of how important communication is in the nursing profession and practice. I mean, communication goes beyond just speaking. It's about building trust and ensuring that your patients feel heard and that you are understanding their needs so that you're able to provide the best care possible.
So, was there anything that really stood out to you?
Ethical decision making is really interesting to consider in the scope of private clinics outside of Alberta healthcare, specifically beauty bars and aesthetic nursing, places where you do Botox and injections and lasers and all of that, because the CRNA pretty heavily regulates the scope of practice for nurses working under Alberta healthcare. They make sure that nurses are maintaining competencies and that they are only practicing a set of skills that they are trained to do. This just means that an OR nurse is going to have a completely different set of skills that they're legally allowed to practice than, say, a mental health nurse would. Doesn't mean one is greater than the other, just means they're allowed to do different things because they're trained to do different things. This doesn't necessarily apply to beauty bars because they're so unregulated. This puts so much pressure on nurses to determine their own scope of practice because there's no specific course that teaches you how to do injections and then says that you're legally now allowed to do injections. It means that nurses it's up to them to protect their non-maleficence, and they're not doing harm to patients. They need to know their scope of practice so well, know what their limits are, know these professional boundaries, and they're dealing with complicated cases, patients who have maybe body dysmorphia, and they need to set aside personal gain because there's so much money to be made in the field of aesthetics, and it's so important that you are making sure that you're putting your patient's well-being first, and your judgment isn't getting clouded by external factors that don't have to do with your patient's health. You're going to deal with confidentiality because now we're dealing with social media, where it's not something that you think about in Alberta Health. Social media is pretty much a no-go. In aesthetics, social media is a big part of how you build your portfolio. That's a really interesting point. After hearing this, is there anything else that you would be interested in learning? Honestly, yeah, I'm really interested to see how nursing works outside of public healthcare and Alberta healthcare. Thinking about private healthcare, maybe international, seeing how it's different. It's really interesting. I plan on reaching out to different nurses and seeing if I can get some of their personal insights on it. It's just mind-blowing to hear about different experiences and how differently these systems work. So now you have this experience. Has your understanding of what being an RN is changed at all? Yeah, so before doing this interview, I really did see nursing as a caring profession, but it just really opened my mind to just how complex and multifaceted and nuanced the nursing profession really is. They just don't only care. I mean, they are advocators. They advocate for their patients. They collaborate with other healthcare professionals. They're constantly problem solving and using their critical thinking skills to create care plans and come up with nursing diagnoses, which I didn't think about that much before the interview. And I was so surprised to see how much nursing diagnoses came up when talking about day-to-day skills and day-to-day tasks. That's a really good takeaway. I'm just curious, did you learn anything about yourself during this process? Honestly, doing this interview was really inspiring. Getting to talk to the RN really, I don't know, got me reflecting and thinking a lot about myself. I started to think about how drawn I am to patient-centered care, and how previously I've thought about nursing as like bedside nursing. And while yes, I still have so much interest in doing bedside nursing, it opened me up to maybe exploring different fields of nursing, and I didn't even think about the fact that I could maybe work in different units as a nurse in the future. Besides that, I got to explore some communication techniques, and I got to really familiarize myself with my own personal style of communicating, and it was really eye-opening. That's really good self-reflection, May. Okay, so now we're down to our last question, and it's a big one. How has this interview changed your perception of the future implications of nursing? Nursing is constantly evolving and constantly adapting to the world around us. We talked a little bit about how my RN had some experience working as a frontline worker during the pandemic when things were rapidly changing. Adaptability is so essential as a nurse. I plan on committing myself to continuous education and staying informed about all the advancements in healthcare. I've heard really firsthand about all of the challenges in the profession, including high stress, the emotional demands, and all of this leads to burnout. We saw so much burnout happening during COVID. I want to help prevent nursing burnout by modeling healthy behavior and wellness diagnoses. This will include things like seeking help when needed, engaging in regular self-care, and setting healthy boundaries. I know that this is what I'm going to do for myself, but I know that there's also a need for change, and I hope that is something that is happening, like better staffing ratios and more mental health support. I will contribute to improving working conditions for nurses by advocating for policy changes. These things are crucial for preventing burnout, and I really hope that I get to be a part of that conversation in the future, because it's something that I'm so passionate about. This has been such a valuable conversation. Thank you so much, May, for sharing your experience.
Thank you so much for having me, and I really hope that this helps others understand nursing as a profession a little better